So it is being recorded for our friends that could not join right now, but feel free to unmute, put your videos on, and we can discuss all things ADK food system.
Hey Lynn, how you doing? I'm just trying to look through our list of participants here. If there's any steering committee members too, if you can definitely come off the video, that'd be great. Great. Well, so maybe I'll just kick it off a little bit. We don't really have any questions, it seems. So I do want to highlight I'm actually going to stop sharing and reshare real quick because my computer likes to switch things up. So if you go to the Adirondack Health Institute's website, you can join the Food System Network, and this is kind of the portal that it'll bring you to. And so if you're interested, and I know a few folks have expressed interest via email or during the first welcome session of joining the system, we can do that. We can add your name to our listserv, but also it's pretty easy Google form right here at the top about the Adirondack Food System Network to get your information in there. This is a very collaborative effort. We don't say no or turn anybody away. And we're a mix of farmers and nonprofits and organizations dedicated to fixing and addressing some of the concerns of the food system. Oh, that's a great question. I just seen that now. I'm going to hold off on that one. And the question from Andrew is, what are some of the best ways for a farmer to market their produce or goods within the Adirondack Blue Line? And I'm probably not the best person to answer that. So I'll let that one sit out there for a little bit. I'll walk through the page and then we can jump to that because that's a great question. There are a few farmers on here. Perhaps they have a better answer. And I know we have some steering committee members that might be more apt to answer that question than myself. So this is just a very general story map about the park and some of the initiatives. Like I said in my welcome, the few tabs that I'm really interested in personally, but for also some of the work that we're doing here are the food insecurity tab, where you can actually measure out what some of the projected numbers are, and they are in real time. And I know it says 2020, but this is actually built off of 2022 live data. So while the tabs are a little crazy, a little off there, but the data is real. And so you can actually break this down. And so when we're thinking about the Adirondack Park, we have the southern, I'm down in Washington County in the southern portion of that, but we have representation through the network in every single county. And organizations that are not only based in one of the counties, but have a catchment area of a larger range. For example, Comfort Food working in 3 counties, Saratoga, Warren, and Washington, but other organizations on the steering committee like ADK Action is working in a larger swath of these counties, or ANCA as well. I also would like to highlight the Food Network resources. And this is really a great page for, excuse me, just letting it reset a second. It's a great page to actually see what agencies and organizations are involved in food access across the Adirondack Park, as well as some of them a little outside in New York State. They are still missing some here, but for the most part, this is a great example of some of the other organizations working within this realm. So I do encourage folks that you can go take a look, hover over one, you can connect. If they have a website, you can connect via that way, or any of the information is going to be displayed there throughout this region. So that's a great resource to check out. And obviously we're constantly adding agencies that they're becoming aware, as we are becoming aware of those things as well. And then looking at some of the more statistical based numbers here, we got the SNAP households characteristic. So really measuring this is one of the, I know Comfort Food as well as some of the other agencies work with a lot of individuals at farmers markets related to SNAP and other healthcare driven solutions for accessing local food at farmers markets. So that is a key component for a lot of the work that we're doing across the network. But one of the biggest things you'll notice is missing, and given we're trying to focus a lot on farmers, is the the map of producers and farmers. And that is hopefully going to be within the next year or two, one of the directions the steering committee, as well as the network itself, is pushing towards mapping out the producers in the region. And to go to the question as well, how do we, get more food to the communities within the Adirondack Park? How do we increase that market viability, and how do we support farmers? So I don't know if anybody wants, I open that up to anyone, that question that was posed, and I can bring up my chat here. Best ways for a farmer to market their produce or goods to folks within the ADK Park. I welcome anyone to hop on that question. I'm not just a member of the network. I think that's a great question, and it's a great kickoff.
I'd be happy to take a shot at answering that question. So I'm the executive director at Pitney Meadows Community Farm. So we're south, but we are members of Adirondack Harvest, which is great networking with other producers, and they do really great social media around highlighting different farms that are, a part of their network. So I think that's a really great starting point. And then also the Adirondack Food Systems Network, we have a producers working group. So thinking about, if that's something that's passionate and want to be a part of, we welcome people to contribute, because there's a lot of obstacles to getting food out there, and we're happy to have different perspectives and hear different solutions. And then also, ADK Action, Craig Garden, Comfort Food Community, Pitney Meadows, we love to highlight and source from local farms. So also reaching out to those organizations and seeing, how you can get involved and what you'd like to supply. Because I know at Pitney Meadows, we have a farm stand. And for us, because we're a public farm, we're happy to welcome people, to introduce them to sourcing local produce, and then kind of giving them the resources and letting them, source from a variety of local farms and not just us. So I think connecting with, Adirondack Harvest to see what resources they can provide. And then also like local organizations, maybe getting in on their farm stand, or seeing, what they've experienced in marketing. And that's kind of my go-to, is ask other people who are doing similar work, because people are very, very willing to help.
That's great. Yeah, I totally, a lot of organizations we have here, we represent significant buying power in terms of product. So it's really just making that product's knowledge available to the organization. So I like that. And I wonder to Mary Godnick, I know you're on the call. I don't want to put you on the spot, but a little bit, because ADK Harvest, I don't know if you wanted to add anything to Lynn's comment, if you are available. I'm not quite sure she's available. All right, Jim, you have a question?
Yeah, if Mary's not ready yet, I'm curious how many of the farm stands have the ability to accept SNAP or any other kind of card payment, because my experience is that most of them are unmanned or unwomaned.
So I can speak to that, because that's an issue that Pitney Meadows has faced.
There's nobody there. Sure.
Just because, access is something that's really important to us. So one way to increase access to fresh produce, we saw as like having a self-serve kiosk, which is very common for farm stands. So we're open dawn to dusk, 7 days a week. People can come whenever, and encourage people to go to the farmer's market first. But because we don't have it manned, we can't offer SNAP. So we are actually making a decision as an organization to limit access to our produce, to kind of increase access by putting farm store hours up, because anytime that you're able to accept cash, you have to be able to accept SNAP benefits, and there's someone that has to be there to accept SNAP benefits. So we could not offer SNAP benefits even if we had someone there some of the time, because essentially dawn to dusk, anyone can come. So if we had more limited hours for SNAP benefits, it would be a form of discrimination. So as an organization, we just decided that it was worth limiting the amount that we were open to be able to offer SNAP benefits. So unmanned stands, if you can accept cash, you also have to be able to accept SNAP, which does make it challenging.
Just one thought. At Adirondack Action, we've developed an online SNAP ordering platform, which is currently implemented at the hub, and it's going to be rolling out into the pharmacies in Port Canton, Keysville, and others. There might be a way, if you could get certified to do that, where people could order ahead of time. They can pay the SNAP portion ahead of time and the cash portion when they come in and pick up the food. That's one possibility. And then you basically have 24/7 SNAP availability.
Yeah, that's definitely something that we're interested in, and we're excited to see that ADK Action and Pub on the Hill, we're piloting that. We actually played with having an online store just for that very reason, to see how logistically that would go. So something that we're definitely interested to see as that rolls out from the piloting stage.
Yeah, we did the adaptation of the hub's ordering system in Shopify. It was done very, very quickly in Shopify, and the online SNAP integrates with Shopify as part of the checkout process.
Awesome. That's really good to know.
It's great that that's coming online too. Brittany working with Brittany for a few months now. She's been touting that, so I'm glad that that is taking off quite a bit. And there is the concern too, bringing that up. Those are centralized locations, and looking at options for farmers to market their produce and other alternatives, such as farmers markets or farm stands, to not only the lack of having someone there to tend to the stand, but also the smaller scale farmers markets that we see across the region generally don't have the resources to not only go through that training, employ someone to run a SNAP benefit or some form. There's a lot of logistical barriers as well. So, and I know that ADK Action is working on the resource card that will put all of the resources like FMMP or SNAP or WIC all together on a card, which I think is a great highlight. I don't know, Jim, if you want to talk a little bit about that as well.
Sure. Well, first of all, the online SNAP doesn't require any human intervention at all. It just requires an ordering app. Ideally in Shopify would be the simplest. And then at checkout, you can pay part of it with SNAP, and part of it gets discounted by Adirondack Action if you're enrolled in our fair food pricing program. And then and part of it can be paid with a credit card. And then you would come later on and pick it up. And in the case of the hub, they deliver. But if it's a farm stand, you just be ordering ahead of time. And then, it's kind of an honor system anyway. So it's also not inconceivable that people could come to the store, the farm stand, fill out a coupon and say, here's how much I bought, and I'm going to go online and pay for it later, instead of leaving a check or cash. Since a lot of it's honor system anyway, that could be workable. The newest project we have that we're going to be rolling out this summer uses a card that has basically been widely used in refugee camps around the world. And it's got multiple wallets. And so what we will be doing is issuing a card to each of the people that are enrolled in our fair food pricing. And then using software, we can add specific amounts of money to each card at the beginning of each month. So a family of 4 would probably get more than a single in a household. And then people use that card at the farm stand with a very simple mobile phone app. They scan the card and then they punch in what they're selling. And we haven't completely decided whether our subsidies, when I say our subsidies, of course, they're provided by other members of other nonprofits and foundations like the New York State Health Foundation. But those subsidies can then be spent either 100% on food or maybe pay for a portion of the farmer market purchase. But again, the idea is, the nice thing about it then is that there's reporting back to us and to the foundations as to almost precisely what kind of food people are buying, who's buying it, what kind of households are buying it, how often they're shopping, and so on. So it's got potential for much better reporting than the token systems.
Great, thank you. I appreciate you allowing me to put you on the spot there a little bit further. That's a great conversation, and the access for farmers to market their product is a big concern, especially with the distance and the terrain and the geography of the Adirondack region. So this is a great step at looking at something like the tech approaches. Does anybody else have another topic they want to introduce, or any questions about the conference, any feedback so far? I know we've just kind of begun and just had our keynote, but we're always kind of looking for other avenues, and I'm sure we can talk about whatever anybody would like. Nancy, do you?
Yeah, so I see that Connie, who is one of our steering committee members, actually popped a question in. She said it's great to see AHI taking on a leadership role for the network. So here's a question for AHI. What motivated you to step up, and what are you looking forward to in the next year? Just for some background for everyone, I'm Nancy Del Mastro, and I'm serving as the project manager for the Adirondack Food System Network program. We received funding from the New York State Health Foundation for this coming year, looking into 2023 as well, to strengthen the work we're doing, which Josh has mentioned. So just for some other background on AHI, because I'm not sure if everyone knows, but AHI is a nonprofit organization that supports hospitals, physicians, behavioral health providers, community-based organizations, and our communities to transform healthcare and really just improve population health as a whole. We have a plethora of programs at AHI. Sarah Duke-Majan runs the Adirondack Rural Health Network, which works with our public health partners. She does community health assessments throughout the region. I also serve as telehealth project manager, which is a partnership with Fort Drum Regional Health Planning Organization. We provide technical assistance on all things telehealth implementation for our partners. We have 80K Wellness Connections. It's a referral platform that addresses social determinants of health needs. We have enrollment assistance services for health insurance, a health home, many others, tobacco-free initiatives. So I think that this program just seamlessly makes sense to be involved with. A lot of our programs are grant funded, and when we had the opportunity to apply for this New York State Health Foundation funding to really support the food system network, just made sense to go for. And AHI will be serving as the backbone organization, managing the program and all related grant objectives and actions, convening the steering committee and the group as a whole. We're bringing on a couple consultants to help us really drive a strategic plan and action plan for the future. So we're really excited to just support the experts in the food system. We have such a strong relationship with our public health, our healthcare industry partners, which I'm excited to hopefully bring on a few more individuals on the public health side to join the efforts. It obviously makes sense, food is health. So I'm just excited to boost the network, get it sort of strengthened in any way possible, and work with more farmers and other organizations that maybe AHI previously hadn't had relationships with. So I think it's just a really exciting opportunity for AHI to widen our reach in the region. We cover the full North Country. We're located in Glens Falls, but our programs stretch all the way to Clinton County and then over to St. Lawrence County. So it's just such a great opportunity to bring everyone together. I think that's all I have to say about that. If anyone from HI has anything else they want to add, feel free. But I think I see something else coming into the chat though, Josh.
So for those who are on their phone, so delivering farm fresh foods to food insecure households is a challenge, but educating people on how to prepare meals that utilize all of the free fresh food is a separate challenge. Who has had success with cooking classes or videos, including menus and boxes, etc., and how can we do that efficiently? I might actually take a stab at this one. So some of the work that I do is around not only produce prescriptions programs directly at farmers markets, so provide and leveraging partnerships with, in our case, CDPHP and Glens Falls Farmers Market to provide low resource individuals along the lines of Medicare and Medicaid with healthy resources for foods based on a seasonality approach that they can find at the farmers market, as well as providing vouchers directly to them. So for a more intensive program. So helping folks access those fresh foods is one matter. And I know, Jim, you pointed that, but then also how do you work with some of those recipes is a significant challenge as well. And also our fresh food pharmacy, which is in partnership with a Hudson Headwaters Health Network. Actually, that is a larger question of not only providing that fresh access to food, but working with their staff to include dietetic and nutrition education along those lines. So it's more intensive, and it involves multiple different partners kind of leveraging their strengths. The healthcare side of things isn't something that's not my background, but the fresh access to produce is. And I don't know if anybody else, I got two hands. I think they're related, but if anybody else, I'm open to, Mary, I saw your hand first.
Thanks, Josh. I just wanted to jump in and say in Essex County, we have a program through Cornell Cooperative Extension, and I know this program is rolled out in most counties in New York State, called Farm to School, where we have an educator that goes into schools and offers taste tests monthly on different seasonal veggies and talks about how they're prepared and talks about how they're grown and gives kids a chance to learn more about those seasonal foods. And so that's one way that we're kind of through CCE, our farm to school educators are working with kids to help them become more aware of different fruits and veggies before they move into adulthood.
Thanks, Mary. And Mary is also presenting later in the conference, so check out her shameless plug for your presentation. And is it Stacy?
Hi, I'm not part of AHI at all. I'm actually in Iowa watching as a student from Marywood University in the dietetics program. But out here, we've had luck just kind of making our own creative partnerships. So for example, I've worked with WIC in the past, and they will send WIC educators over to the food bank during food pickup times that tend to have more parents with young children. And then we will cook something that the food bank has excess of and provide a recipe for what we have prepared that they'll be getting in their boxes that day. But then it serves twofold because we can make sure that those families coming in are also enrolled in WIC. And just catch people in case they don't know that the benefits are available to them or anything like that. So just fostering kind of creative relationships between groups is a good start.
Great, thank you for that. And I will add too, it's also not only including that education, there's a lot of what we face in the North Country as well as other parts of the state or the country is looking at how people can actually prepare that food is a limitation, and that has to involve some flexibility and pivoting. I've worked with a lot of folks who their only source of a hot meal is a hot plate. So factoring that, or for someone's in a single room occupancy motel, which is very common in the North Country, or a camper, you have to limit your availability to that the food that is provided. Or if you're dealing with older individuals, you know, I always reference the butternut squash. It's great to give them a butternut squash, but if they, you know, there's a handful of dexterity issues or arthritis, it's like, that's a huge squash and a lot to prepare. So thinking about how our education materials reflect that as well is another added challenge, another layer to Jim's question. Julie asked educating the parents. How are you doing this? Anybody have experience doing that? I do know some of our farm to school educators with Cornell actually work within the schools to educate students. And there's, I'm working with food service directors to do that as a way.
Yeah, this is Julie. I teach child psychology. I live in New York City, but my kids went to camp in Paul Smith's, and we spent many years in the region. So I know the region. And, one of the things I present in my classes is it's one thing to show the kids, this healthy food, but if you're not educating the parents and the kids go home and they're eating the same stuff anyway. So that's why I asked that question.
Oh, great. I appreciate the context. It's a good question, and I'm not sure I have an answer other than I know, third party responses. Mary, answering
I can
that.
just respond. I totally hear you, Julie. I think the formula with the farm to school program is actually to introduce kids to the foods to prove that they like it, because a lot of times schools are hesitant to serve new foods or incorporate local foods into their menu because they're under this understanding that the kids won't like it. And so it's a way to help funnel interest back to the school so that those meals can be more nutritious too.
Yeah, actually, I think New York City, I read, is on Fridays, they're going to serve a vegan meal every Friday. This is going to be very interesting. Yeah, very interesting. We'll see.
Right. Yeah, that is a
I can't because I'm typing. I take
no worries.
notes. So
Yeah,
let me.
Go ahead. Sorry, Julie. I think we're having some feedback.
No, I'm taking notes. So that's why I just flipped off my camera.
Gotcha.
The kids' taste is no.
Yeah, and that's something that the Vegan Fridays, I think, is a push just to generate that push towards local product availability within schools, more so than the nutrition side of things, at least in my understanding. Does Cornell Hospitality Program have volunteers in their undergrad program? I don't have that answer. That's a good question. I don't know if anybody's from Cornell on the line. Don't think so.
Josh, just looking at time, I know we're at the half hour and this was a half hour session, but I want to remind everyone that we will be doing the same session tomorrow at the same time at 12 to reconvene on any of the topics we might not have been able to cover today, or if anything comes up from the various presentations this afternoon and tomorrow morning, please feel free to join us again tomorrow.
Yeah, absolutely. And I'm happy to stay on a little bit longer. I know some people have to jump off for prep for the next session. Erica put in the chat, the Cooking Matters campaign. That's a great resource. Thank you for doing that. I don't know if, Erica, you want to add anything to that? Not to put you on the spot. Oh, no worries. You're all good. Great. Well, this was a great conversation. There's some great questions in here that I got to find answers to, and I want to find answers to. So, maybe we do end it there. We'll pick this up back tomorrow. We're going to have a little bit more farmer focused of a chat perhaps tomorrow, given our second day is focused on some great farming presentations. And we'll have 3 great presentations this afternoon. And that'll give us a lot of food for thought. And I'm going to use the pun. So, all right, everybody. 1 o'clock, we have John Culpepper and Katie Culpepper with ADK Action. So we'll see you then.
Thanks, everyone.
Bye.
All right. I'm happy to stay on and chat too. I was just seeing who wanted to leave and not, but
Yeah, Josh, I'm gonna keep the meeting open just in case anyone else has questions.
yeah, great. All right.
Don't mind my dog.
Well, I guess maybe perhaps I don't really have anything I want to talk about, and I don't want to keep folks here. So maybe we actually Andrea, do close the session. And if you have any questions, feel free to reach out, anybody to Nancy or I. We'll happily answer them or include them in our next lunch conversation.
Thank you.
Thanks.